Thank you, Helia. All right, well, welcome everyone. Today's our May CEC network meeting, and we're just about to the end of our fiscal year for those of us that run July to June. So hope everyone's had a successful year, and looking forward to the next fiscal year and those challenges that we or the goals that we set for ourselves. So thank you again, everyone, for joining us today. We have a pretty full agenda. We have Kern County Aging and Adult Services. They'll be talking about the HICAP program, the Health Insurance Counseling and Advocacy Program, which kind of ties in really well with what we do. And also we're having Kern Health Behavioral Health talking about the Consumer Family Learning Center. So those two very important programs in our community. As you know, May is Mental Health Awareness Month. So that's why they're here, and they're talking about those resources for the community. And then we'll also provide a Medi-Cal and Covered California update, and then we'll allow a little bit of time for any announcements that you folks may have. All right. So with that, we're going to move right into our first presentation, and we have Lauren Higgins from the Health Insurance Counseling and Advocacy Program, HICAP. So Lauren.
Hi, thank you so much. Could I share my screen?
We do have the presentation up on the screen, but if you want to go ahead and share it yourself, that's fine.
Thank you so much. Okay, one moment. Okay.
There we go. All right.
All right, so good morning, everybody. My name is Lauren with Kern County Aging and Adult Services. Also with me, I have Carolina, who is our INR program specialist and HICAP counselor. She can assist in answering any questions at the end if necessary. Today, we'll be discussing HICAP, or the Health Insurance Counseling and Advocacy Program, what HICAP counselors do and who they serve, what Medicare is and who's eligible for it, Medicare options, and what being Medi-Medi means for beneficiaries. HICAP provides free and unbiased information and counseling about Medicare. HICAP directly helps beneficiaries to understand the complexities of their Medicare benefits, including prescription drug plan coverage, Medicare Advantage plan choices, Medicare supplemental policies, Medicare savings programs, and long-term care insurance. HICAP counselors also assist dual beneficiaries who have both Medicare and Medi-Cal or are Medi-Medi. HICAP also assists beneficiaries in finding the most cost-effective Medicare plan after they have determined which coverage options they would like to choose. So the Health Insurance Counseling and Advocacy Program, the services are for Medicare beneficiaries, those who have aged into becoming qualified for Medicare coverage, disabled adults under the age of 65, and those who are dually eligible for Medicare and Medi-Cal. Who provides the services? HICAP services are provided by highly trained volunteer counselors. Our counselors receive extensive initial training followed by continued training and updates by CMS, or the Center for Medicare and Medicaid Services, California Health Advocates, and Medicare Rights Center. HICAP counselors are then registered with the California Department of Aging and become certified in assisting Medicare beneficiaries in understanding their coverage options so that they can make the most educated decision on which route to take. So who's eligible for Medicare? There are different ways that one may become eligible for Medicare. Those who are turning 65 will age into Medicare and be able to choose their coverage options within a 7-month period called the initial enrollment period. Individuals who are under 65 but have been receiving Social Security disability for 24 consecutive months are automatically enrolled into Medicare and will receive Medicare card in the mail when their 2 years of disability have been met. And finally, people who are retiring from work. They can be eligible for Medicare if they are older than the age of 65 by the time they retire. But sometimes you have individuals who retire early. For example, if somebody retires at the age of 62, he or she may be eligible for Social Security benefits, but will not yet be eligible for Medicare until they turn 65. Another scenario would be individuals who continue to work after the age of 65 and don't retire. They will have the option to choose whether they want to keep the employer plan and opt out of Part B, or enroll fully into Medicare and disenroll from the employer coverage. What are the parts of Medicare? There are multiple parts of Medicare, including Part A, or hospital insurance, which helps to cover hospital stays, skilled nursing facility care, hospice care, and home health care. Part A will be free for most people who worked at least 40 credits, but for those who didn't join the workforce, they will pay a premium. Then there's Part B, or medical insurance. That helps cover the services performed by doctors and other healthcare providers. Part B also covers outpatient care, home health care performed by physicians, durable medical equipment such as wheelchairs, walkers, hospital beds, and other equipment, as well as preventative services, so like screenings, vaccines, and other wellness checkups. Part B isn't free. Beneficiaries do have to pay a monthly premium of $170.10, which will come out of their Social Security benefits if they are withdrawing. If not, then Social Security will send them a quarterly bill for their premiums. Part B and Part A both have annual deductibles and coinsurances for services. And then we have Part D. Part D covers the medications that beneficiaries have been prescribed by their doctor. It can also cover some recommended shots or vaccines. Medicare Part D plans typically do not cover vitamins or any over-the-counter prescriptions. Plans that offer Part D are run by private insurance companies that follow the rules set in place by Medicare. Prescription plan coverage will also have a monthly premium, deductibles, and coinsurances as well. So what are the Medicare options? We have essentially two different options for Medicare coverage. The original Medicare option includes Part A for hospital coverage and Part B for medical coverage. If beneficiaries do not have any other form of creditable prescription drug coverage already, or prescription coverage that's at least as good as what Medicare offers, they can enroll into a Part D prescription plan to avoid any late enrollment penalties. Beneficiaries can also add a supplemental coverage such as Medigap policy, a policy from a former employer union, or Medi-Cal to cover the remaining 20% that original Medicare does not cover. So in original Medicare, basically parts A and B will pay 80% of approved services, and the supplemental, whether it's Medi-Cal or a Medigap policy, it will cover the remaining 20%. Beneficiaries have the freedom to go to whichever provider they want as long as they accept Medi-Medi. The second option that beneficiaries have to enroll is Part C, or Medicare Advantage plan. This option includes Part A, Part B, and most of the time Part D. Some plans offer extra benefits like basic dental, vision, or transportation. In general, Medicare Advantage plans are managed care plans, or to put in other words, they are all HMOs here in Kern County, and beneficiaries will have to go to the providers within the plan's network. So on one hand, we have original Medicare with Parts A and B, and HICAP assists the plan with plan comparisons, and they help find the most cost-effective plan. If they do not have any form of supplement, we help them apply for Medi-Cal, If they do not fall within that income limit, they can also choose, whenever they're first signing up for Medicare, they can choose a Medigap policy, and we can help them with that comparison as well. On the other hand, if the person wants a Medicare Advantage plan, HICAP runs comparisons based on the medications that the beneficiary takes and make sure that their plan will cover their prescriptions at the lowest cost. How does Medi-Cal work with Medicare? When a Medi-Cal recipient becomes eligible for Medicare, the process of transition is sometimes seamless for the beneficiary, but it can be confusing. They sometimes believe that they have to do something or make decisions, but HICAP can help them navigate and explain the process. When someone had Medi-Cal prior to having Medicare and they become eligible, Medi-Cal will do what's called a redetermination. This is where they will evaluate if the person will continue to qualify, but this time under the Aged and Disabled program, which has different income and asset requirements than the MAGI program. The beneficiary will receive redetermination paperwork in the mail to state their assets, expenses, and income. Medi-Cal will then determine if they will receive full scope Medi-Cal or Medi-Cal with the share of cost, which we'll discuss in one of the following slides. Once a person is eligible for both Medicare and Medi-Cal, the state will be notified and a few things will happen. First, the beneficiary will receive what's called extra help. It's a program from Social Security that helps the beneficiary pay for prescriptions, including their prescription drug plan premium, deductibles, and most of their copays. Second, the beneficiary will receive help paying for Part A and Part B through the Medicare Savings Program, which I'll explain also on the next slide. Once the beneficiary has gone through their transition and is fully Medi-Medi, they will have 3 forms of insurance. They'll have Medicare Parts A and B, which covers 80% of their services, and Medi-Cal covering the remaining 20% along with their prescription drug plan for their prescriptions. For Medicare beneficiaries, Medi-Cal will also pay their Medicare costs and will cover or will offer added benefits such as vision, dental, transportation, in-home supportive services, incontinence supplies, and hearing aids, which original Medicare does not cover. Ways to save on Medicare costs. Medicare savings programs, or MSPs, are benefits administered by Medi-Cal to help low-income beneficiaries pay for the Medicare costs, including Parts A and or B premiums, deductibles, and coinsurances based on the level of assistance they qualify for, which is determined by their income. The Qualified Medicare Beneficiary, or QMB, now has a monthly income limit of $1,133 for a single applicant and $1,526 for a married couple. If qualified, Medi-Cal will pay the beneficiaries yearly $1,556 Part A deductible, $233 Part B deductible, and $2,041 Part B premium for the year. The specified low-income Medicare beneficiary, or SLIM B, as we call it, has a monthly income limit of $1,359 for a single individual and $1,831 for a married couple. And then the last plan, the Qualified Individual, or QI, has a income limit of $1,529 for a single applicant and $2,060 for a married couple. So both of these plans, the SLIM B and the QI, pay Medicare Part B premium only. Additionally, somebody who applies for Medicare savings programs, they don't have to apply for Medi-Cal as well. But if they do apply for Medi-Cal for the, and they qualify for the highest extent of Medi-Cal or full coverage, they will get the Qualified Medicare Beneficiary as well, or QMB. Medi-Cal share of cost. If someone has Medi-Cal with a share of cost, it means their income is essentially too high for them to qualify for the Aged and Disabled program. The share of cost is essentially an insurance deductible. It is monthly amount beneficiaries have to pay before Medi-Cal will kick in. The share of cost does reduce as the individual pays monthly co-pays, deductibles, and purchases their prescriptions. When the amount paid in the month equals the share of cost amount, Medi-Cal will be paying out for out-of-pocket medical expenses until the share of cost starts over again the next month. This is something that we work with every day. In HICAP, we can assist them if they do have a share of cost. We get people sent to us all the time for through DHS, and if you guys ever have anybody that you need to send our way to help with the share of cost, we can definitely do that. So if somebody wants to change their plans when they have Medi-Medi, but change their prescription drug plan or their Advantage plan, if they choose to have those, beneficiaries who have both Medicare and Medi-Cal have the opportunity to change their plans once a quarter for the first 3 quarters of the year. And if they elect to make a change, the coverage will be effective the first of the following month. Beneficiaries can also make one change during the annual election period, also known as Medicare's open enrollment. It runs from October 15th through December 7th. If a plan change is made during the annual enrollment period, it won't take place until January 1st. So in general, if a Medicare beneficiary needs assistance in finding the most cost-effective plan, understanding their Medicare options or current coverage, or requires a share of costs, the HICAP program can assist them. And so that's pretty much all I have for today. We will be sending a link for a survey. And if anybody has any questions, we can go ahead and answer those now.
All right, I did place a message here in the chat if you wanted to ask a question, but you can go ahead and ask the question directly to Lauren. I don't see any hands up yet. Let me see. Does anybody have any questions for Lauren?
I just had a quick question in regards to the survey link. What is that for? And I just copied and pasted it into the chat, by the way.
Okay, thank you. So that is just a survey of like how well the message came across today. We do have to send out those surveys every time we do a presentation. You don't, it's not mandatory, it gets filled out, but we do have to send it out.
And Lauren, just to clarify on the eligibility, when people turn 65, they're eligible. When they're disabled after 2 years, they're eligible for Medicare. And then when they retire, if they retire early, they're not eligible for Medicare yet until they're 65, correct?
Correct. So if they're 62, for example, and they retire, they can get Social Security benefits, but they will not be eligible for Medicare until they turn 65.
And now let's say they are 67 and are just now retiring. What happens if they don't enroll when they turn 65?
So it's fine if they want to, if they opt into keeping their employer plan, then that's perfectly fine. But if they decide that they do want Medicare after that, they will have a period of time that they will have to enroll, or they will get some late enrollment penalties. So they can choose to still keep their employer plan for as long as they would like, and then switch over to Medicare.
All right. And what if they're working part-time and they're not offered health insurance, but they don't enroll into Medicare, and they're 65.
Okay.
Sorry, 67.
No, I understand. So then at that point, they would, nobody necessarily has to have insurance, but you know, it's something that's needed. So at that point, if they don't enroll in their initial enrollment period and they then need insurance or they need to go to the doctors or have their prescriptions covered, so they do enroll, they'll have late enrollment penalties.
Okay. We want to make sure that we help educate them on the penalty so they can avoid that.
Absolutely.
Great. All right. Thank you, Lauren. Any other questions?
I have a question. So someone that has a high share of cost, do you guys also assist them? And I'm sorry if I missed that, if you mentioned it. Do you assist them like buying like additional dental insurance or additional vision insurance so that can be counted as a deductible?
Yes, so there are those options. There's multiple options. They can choose to have a prescription drug plan that has a premium, or a Medicare Advantage plan that has a premium, or a dental or vision plan. So there are multiple options. We do have a connection with DHS to where we can find out, you know, exactly how over income they are. And then they can decide which type of insurance policy to purchase. That way it can either reduce or eliminate their share of cost.
Okay, and then once you assist them with that, would they be the ones reporting that to DHS, or would it be you guys, the ones?
It would be us.
Okay.
Yeah.
Thank you.
Yes, ma'am.
All right. And Lauren, do you also provide assistance with enrolling into Medi-Cal or just
Yes.
Medicare? Okay.
We assist with renewals. We assist with initial applications. And, you know, a lot of people call in whenever they have to do their redetermination. They're confused about what's going on. So we can give the information for that as well. But we do actually help people enroll or apply or their renewals.
Great. Thank you, Lauren. Any other questions? All right. Well, thank you, Lauren. Thank you, Caroline.
Thank you.
We're going to move along. As I mentioned, May is Mental Health Awareness Month, and current health behavioral and recovery services is here. Sandy Meeks will be telling us a little bit about the Consumer Family Learning Center and what services they offer to our community. So Sandy, oh, I think you're on mute, Sandy.
There we go. I was just practicing.
Okay.
Thank you very much for inviting us to come and share about our Consumer Family Learning Center. I will be joined and we'll be trading off slides with our CFLC Unit Supervisor, Yolanda Rosas, as we move along. Next slide, please.
Okay, everyone. Sorry.
No, go right ahead, Yolanda.
So I'm Yolanda Rosas, and just to tell you a little bit about the Consumer and Family Learning Center, it is a community resource for people who have either been diagnosed or are the family members of someone who is dealing with a behavioral health diagnosis. And so the Consumer and Family Learning Center helps those individuals to engage in recovery. We support their recovery. The Consumer and Family Learning Center is part of the Behavioral Health and Recovery Services, and we are funded by the Mental Health Service Act. And so this is very important as well, because being under the umbrella of the Kern Behavioral Health and Recovery Services, it helps us to be part of their overall treatment. So an individual might come to us being referred by a treatment team, and we will just coordinate with that team and be part of that recovery, be on a treatment plan. And so the communication is a lot smoother when it comes to the overall recovery of a person who's dealing with either a mental illness or a substance abuse and/or substance abuse. Okay.
Next slide. Next slide, please. Okay, our purpose of the Consumer Family Learning Center is to provide a safe and nurturing environment for everyone so that they can achieve their vision of behavioral health recovery, while we're also promoting acceptance, dignity, and social inclusion. Next slide.
And what we offer are services that are, again, funded by the Mental Health Service Act, which means that we are not asking individuals to have medical insurance, and we're not, there isn't a fee for the services. So in essence, all of our services are covered. Our support groups can and sometimes are led by peers. And so these are individuals who are in recovery, and some of them are at different stages in their recovery. And so they will help us by being a lead in some of the groups that we have going on. Our groups focus on self-empowerment, and again, they are recovery oriented. So anyone coming into the center, first of all, is that they have to be impacted by a mental illness. And then secondly, that they are in the mode of recovery. They want something better for themselves. And so the individuals attend the groups that best fits their needs. And so, the groups are either a skills-based group, they might be an activity-based group, or when we are actually on site, which we are not right now, we could also have groups that are out in the community, like going and exploring other communities. So pretty much that's the type of groups. There are 3 groups that we do. Next.
Okay, so why members attend? Well, there are several reasons. We ask them when they come in, what is it that you hope to gain from us? What is it that drove you to come and ask for some extra help? Some of those categories would be behavioral health recovery supports or attending a support group. And sometimes a treatment team will say, hey, this would be a good resource for you. They have some skills development and help you learn some coping skills to be able to work your way toward recovery. We aren't doing the work for them. We're just assisting them on their own journey to recovery. Sometimes they come just for socialization and making friends. They'll attend a group, and that sometimes normalizes what it is that they're going through. Often people think I am the only one that feels this way, but when they get into the groups and they meet the other members, they realize it's a lot more common, and they're normalized in that way, that they aren't the only person experiencing whatever it is, whatever the barriers or the hardships. But we also support family members. So some of our members come to the groups because they have someone in their home who's been recently diagnosed with a mental illness, or perhaps is dealing with a substance abuse issue of some sort. And a lot of times families, they say things trying to help in a loving way, but they just don't understand. So when they come and attend our groups, they're able to get a better insight as to how the symptoms are being presented and how to best deal with those, and to prepare themselves and collect some resources so that they can be a better support to a family member or a friend or a community member. Next slide.
So what we have at the CFLC is that on a monthly basis, we are listening to our consumers and hearing from them like their identified needs, different areas that they see a need in, and we start to create and develop curriculum around the different topics. And so on a monthly basis, we put out a calendar that will list all of the different groups that are being offered for the month. Like in the month of May, we had 28 groups that we were offering throughout the week. And some of these groups are either in English or Spanish. We have like one Spanish group Monday through Thursday, and they are addressing different areas of recovery, such as depression management, overcoming anxiety, conflict resolution, and just a self-care and meditation focus. So like I said, the groups can change from month to month. But we do use a curriculum that's being developed to make sure that we are using the best, most updated information when we are helping someone to identify coping skills and to help them through that. So the members can receive, and we definitely encourage them receiving a copy of the calendar, either through a hard copy that we can mail out, or we can also send a copy to their email. And so we try to keep our members' updated demographics so that if they stop coming for a month or two, they could still jump in on the third month without any problems.
Here's just an example of some of the groups that we offer. Yolanda mentioned a few of them. And we did include as a handout our May calendar. As Yolanda said, they are updated monthly. And because we're doing things from a distance, we have a little bit of gap in time so that the calendars aren't always available on the first of the month, but they'll be within the next few days after that. So the most current one is always available on our website. Some of the groups are things such as overcoming anxiety and depression management. I would have to say both of those seem to be our #1 requested groups. We have Seeking Safety, which is a group for women who have experienced PTSD and or addiction. That group is very beneficial because it addresses some things that are specific to trauma that the women have experienced. And we find many times trauma and addiction kind of go hand in hand. So that group is a well-attended group, and it's only facilitated by women. So we also have groups such as DBT skills, conflict resolution, building blocks of communication, preventing mental health relapse, recovery in action, which is our addiction counseling group. And they do have a group each day of the week. And that's specific to addiction issues, but many of those individuals also attend all of our other skill group. They're open to them to attend any of our skill or processing groups. And emotional support in difficult times. That's a good example of how we developed a group for client needs. When COVID hit and people were, thrown where their whole world was turned upside down, including staff, we had to come up with a way to help people understand this is how we process when things are difficult. Difficult does not mean just a grieving group, but of course it's open for those who are grieving, who are going through anything that they themselves consider to be a difficult time. So it's a good emotional support group where even the members encourage and uplift one another. Next slide, please.
The benefits of the participation to our members is that there is a normalizing of their experience that happens when they get to see other people who are experiencing similar emotions, maybe not the details of what's bringing up that emotion, but the normalizing piece is in that, okay, you know, other people hurt too, other people feel anger too. So that piece is the normalizing piece that is very healthy in all of us. The groups also help us to get a sense of our own recovery and be able to narrate our own recovery story, be able to share it with others when we see the impact that it's having on other people when they hear our story of recovery. It is very encouraging. It also provides skill development and practice in a safe place. It provides coping skills to, you know, be able to manage the stress, as stress is part of life, as we know. But the more that we practice the skills to maintain that healthy level of stress, the better it is for us. Also coming into the CFLC, it provides for more awareness of other community resources. We do open our center when we are on site to invite other community resources that have, you know, something to offer our consumers, and we definitely invite them over. The CFLC also offers a sense of community as far as peers. And we hear a lot of the, you know, overcoming the negative thoughts and focusing on a positive lens into recovery. Next.
Go ahead, Yolanda, you wanted to share a member story?
We definitely have, as a result of being open to the community and encouraging folks who are dealing with mental illness or the family members to come in. We hear of the different experiences. And one of the stories of recovery that's coming up for me is we have a Hispanic gal, maybe in her late 50s, and she experienced her son committing suicide. So for 2 years, she was in a place of, you know, a lot of grief, a lot of hopelessness, a lot of, you know, trying to understand the reasons why, and a lot of guilt and blaming. And this was also causing disruption in her other children and her relationship with them. So as a result of coming in and having a place where it's a safe place, that we definitely, one of the requirements is confidentiality, meaning that if the experience is not yours, you are discouraged from talking about someone else's story. And so providing this safe place, she was able to come in and little by little hear how other members were sharing about, you know, conflict in their relationships with adult children or minor children, and slowly trusting the process, trusting herself, and eventually opening up and talking about her relationship with her son and the impact that his suicide has had on her. And as she was able to open up and she received a lot of support from her peers, she is now someone who attends on a weekly basis and is a very outspoken supporter of learning how to identify when your children are having challenges, whether it's in any addictive form, and learning how to be supportive to their children while setting some boundaries, but also doing it in a way where it is non-judgmental and supportive. And it's just something that will humble you as you see the process and the progress in the individuals. So that's one of the stories that from the experiences that comes forward. So next.
So now we're going to talk a little bit about the orientation process. So we've been saying member, 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 and a lot of times people think that means some sort of membership process. Well, for us, it's very simple. The individual will contact the CFLC at our main office number there, and we'll schedule an appointment for an orientation. Many times they can have an on-the-spot orientation. The individual will have the opportunity to review all our guidelines, which are very simple. They're really just common decency. They explain what we've been telling you in this presentation, who we are and what we believe in, and we review the guidelines. We look at the calendar together, and we read look at the group descriptions so that the individual can pick the groups that they think are most appropriate for their recovery goals. We do not give them a list of requirements. They simply can take whatever it is that they think that will forward them in their recovery. Sometimes in the orientation, they don't know what they want yet, but we can listen to their story and we can kind of guide them. Many times it's anxiety or depression that is the root of everything. So we can kind of suggest some classes and explain what they are, but they aren't bound by any means to take what I think would be their best route. They're considered a member at the completion of the orientation. It's that simple. So the member is then added to the group roster for the selected groups that they wanted. And currently we're doing everything remotely. We're not able to open for in-person services yet, though we're hoping to do that again really soon. There's 3 ways to currently access the groups. The individual has a phone number that they can dial, similar to Zoom. We use the format of MS Teams. So they can dial a number and enter the group number and be part of the group, or we can send them a link to follow, or we simply just call them in the group. So the facilitator will look at the roster, they will call each person on the roster, and they will just invite them into the group. We find that many times, actually this remote has been very beneficial because some of the individuals would be more apprehensive to walk into a strange building and sit with a bunch of strangers and try to talk about some intimate things. But they kind of enjoy being able to access and keep their cameras off until they're comfortable with the group setting. And then they're able to, eventually they'll have the cameras on and be speaking up. And then they feel more comfortable following a link to be in the group. So it's very much depends on what it is that the member wants to do, how comfortable they are with getting into the groups. So that's how you can help them too. Okay, so that brings us down to questions, and hopefully we have the answers. Between Yolanda and myself, we'll be able to either provide you an answer or we'll be able to get one and get it back to your group.
And Sandy, I think just something else that's coming up for me is that anyone being referred to us, they do not have to be open to the system of care. So it means that they do not have to go through our access and assessment process.
Right.
It could be someone who's being referred by their doctor's office. It could be someone being referred by a family member. It could be someone being referred by DHS, anyone in the community. And so we are a direct access and linking point for someone coming in without being open for services. But if we see that in the process, they would benefit from being open to the system of care, then we can help in linking them back.
Mhm.
All right, and we do have a question here in the chat. Let me read it out for you. So you mentioned that a person does not have to have health insurance. Does that mean that all the services you provide to this person will be free of charge?
Absolutely. All of our services are free of charge. Our funding comes from the Mental Health Services Act. So we are covered. And when anyone comes into, there's no fee, there's no group charge or anything. In fact, when we're open in public, one of our big groups that people enjoy the most is our art groups. And our art supplies are available to them. They come in, they participate in the group, everything is supplied. And when they're done, they take home their project or their painting or whatever they worked on. So all materials are given to them at no cost ever.
Okay, great. Thank you, Sandy.
Mm-hmm.
Initially, you mentioned that the persons receiving the services needed to be connected to some type of recovery services, either themselves or family members that wanted to participate or could participate in the services here. But then you clarified that they can be persons from the community that are referred either by a community agency, self-referral, or a family member. So just to make sure that who qualifies or who is eligible for the services, is that open? So that does that mean it's kind of open to everyone in the community?
It
Definitely is. And when we say it, they just have to be at a point where they are seeking recovery. We mean a state of mind where I want to deal with whatever I'm dealing with differently.
Mm-hmm.
Great. Okay.
Yeah.
All right. Follow-up question to the one mentioned earlier. Also, what about a person who has health insurance with a high copay and cannot afford to pay the copay or deductible?
There is no copay. There are no charges. We don't collect any insurance information. It doesn't matter if they have Cadillac insurance or they have none at all. We are open. Our doors are open to anyone for any reason. If they are wanting to do something for themselves, if they really are wanting to work on dealing with some hurts or some issues such as anxiety or depression, or wanting to learn more about a diagnosis they may have received, or learning more about how to help a loved one who is experiencing some of these symptoms. Again, no insurance necessary at all.
Great, thank you, Sandy.
Mm-hmm.
And is there a flyer available, and is there support for Spanish speakers?
There is definitely support for Spanish speakers. And, my experience has been that they have been some of the most loyal members, in that they don't only participate one time a week. They are on average participating 3 groups a week. So this is like a 60-minute commitment a day. I'm sorry, a 90-minute commitment a day, and they're doing it 3 to 4 times a week. So it's a very interesting phenomenon of how they are really, once they engage, they're very faithful.
Mhm. And as far as flyers, you can access all of our information on our website, which is kernbhrs.org. And you will just, when the main banner comes up, it changes. But if you scroll down below it, there's 4 boxes. And one of them says Consumer Family Learning Center. If you click on the little tiny white arrow on there, it'll take you to our page, where it has all of our information, and our calendars are listed there, our phone number. Anyone can call at any time, and we can email out whatever it is that you need. So if we can be of any assistance to any of you, if you have someone in mind, or you want more clarification, please feel free to reach out to us, and we will make sure that we connect you with the information you need.
Thank you, Sandy. And Marisol here from the office posted a link here in the chat, and I believe that's the flyer PDF version of it that's linked from your website. So
Correct.
thank you, Marisol, and thank you, Sandy.
Thank you so much.
Any other questions for the Consumer Family Learning Center staff here before we move on? Well, thank you, Sandy, and thank you, Yolanda. It's a great presentation, great information.
Thank you very much.
I'm sure
We enjoy
we'll
being
make those resources available to the clients that we serve. So thank you very much.
Mhm.
Well, we're going to move on. We're going to do an update on Medi-Cal and Covered California. So for our Medi-Cal update, we have Nancy here from the office who'll give us an update on what's going on with Medi-Cal. Nancy?
Hello, and to everyone, and welcome. I see kind of some familiar faces, some faces that are new. Thank you for joining us. We just wanted to share some information pertaining to the Medi-Cal program. As we know, due to pandemic, at this time, renewals are not being completely processed. They're kind of being passed along, even if documents are not submitted. We have been asking some questions to our local Medi-Cal office to see what updates, changes we have. And as of right now, the pandemic order has not been lifted yet. Renewals will continue with the same process they were before, which means if for some reason the client is not provided, they will not be disenrolled from the program. Not only that, please, if you do assist clients, please highly encourage them to submit those renewals. Even though they're not being processed, they are highly encouraged to be submitted, even submitted without documents. Again, we do encourage those documents to be included, but if for some reason they don't have them or they're delaying on them, please assist them with those renewal packets to be submitted. Other documents or other information we also have is pertaining to Benefits Cal. We had previously heard from some of you members that you wanted some information as to, documents that are being submitted, what documents can be submitted, how the application process is handled, and information we have for Benefits Cal pertaining to documents. Once you submit an application, it's highly encouraged to include documents. But let's say 2 weeks from now, you need to upload a different document. The client just recently learned that she's pregnant and she wants to submit that documentation. Before, we used to fax it in, but we are highly encouraged that if we do have a Benefits Cal application there, for us to go back into that client portal and be able to upload those documents. Those documents could be uploaded at any time. So that's information directly from DHS. If you do have some problems uploading some documents, please outreach to definitely DHS, and they will definitely kind of guide you as to what to do, because it's understanding and their understanding that we should not be having any hiccups, any problems uploading documents. And again, they could be uploaded at any time. If for some reason you do need to fax some documents and you have submitted a Benefits Cal application, you can fax them in. Please remember to include the benefits count application number and also any identifiable information that will help to link this application. For example, date of birth, address, social security number, of course, all that after the cover sheet. So that's another way to provide documents. Please remember the fax number that we have been highly encouraged to use for supporting documents is the number 661-631-6573. That is the secure fax number there for DHS. And let's see, going back to a little bit in regards to 50 and older. As you know, at the beginning of this month, clients 50 and above are potentially eligible for full scope Medi-Cal. We wanted to know how long before will the client be in full scope Medi-Cal. As per DHS, all those that are 50 and above that were before in restricted Medi-Cal due to citizenship or residency have already been transitioned to full scope Medi-Cal. There has been some hiccups, not completely all have. And for those that they had the hiccup for, they should have been already worked on and they should be good. So as many of you are CECs, we highly encourage for you to help those clients with the health plan. Remember, if the client does not choose a health plan or a doctor, they will automatically be enrolled into one. And it could be a plan or a doctor that probably too far for them, or they really didn't want that location. So please encourage and please help those clients that you are serving. And as of right now, we do know no cases for Medi-Cal should be disenrolled. So if you do happen to run to any case that has been disenrolled, a child or a family member, please outreach to DHS. As you know, we always have Ms. Kayla Hughes here on the line. Unfortunately, today she couldn't make it, but she is one of our contacts there at DHS. She has provided in the past her email address here on this meeting. But if you also need any support, please remember CHI is here to help you. If we could go ahead and include the income guideline, please here on the screen. Many of you wanted the new income guideline. We used to provide it every year. Right now, recently, I believe we hadn't sent it out, but we will, I believe, be sending it out here shortly. This is the income guideline that we CHI use for pre-screening. There's some questions there that we utilize to help us kind of see what the client might potentially be eligible for based on the income guideline, and then on the list of supporting documents that we know DHS will need. So we're always trying, again, to submit an application as complete as possible. So this is the new income guideline for 2022. Remember, this is the guideline that we utilize for not only Medi-Cal, but also Cover California, and also the other program for pregnant women that don't qualify for Medi-Cal because their income is too high. So I'm pretty sure we'll be sending this as a, Argelia already added it here to the chat. So if you would like to download it, please do so and to utilize it. And if you have any questions, please let me know. It's nice seeing you all, and I wish you a good day. If you have any questions, please let me know.
Thank you, Nancy. Very informative update. Do we have any questions for Nancy?
Nancy, this is the first time that I'm seeing the income guidelines this way, broken down so detailed. And I don't know if you've done this here before, maybe you and I can connect outside, but I'd love to have a breakdown and you walk me through what I'm looking at and how to understand it.
Definitely. I'll give you my phone number right now. I'm not sure if you have it. 661-632-5063. And this income guideline layout is one that CHI created. We created this many years ago, and we just continue updating it with the new income guidelines that come every year. And the questions that were placed there, again, we also created that and we shared it with before CAAs and now CECs. But please give me a call.
Okay, thank you.
Yeah, and Cover California uses sort of a similar layout, so they kind of all look very similar. They're just the different color scheme. But we been using this format for quite a while now. All right. Well, thank you, Diana, for your question. Thank you, Nancy, for the update. We're going to move on to Covered California. And
Actually,
Covered
Rodrigo,
yes.
Marisol will be sharing something with the
Oh.
group as well, Cecilia.
All right. Well, Maritza, go ahead.
Marisol.
No,
Oh, sorry.
it's
Sorry,
me.
Maritza. Sorry, Maritza.
Yeah.
Sorry, Maritza.
Before we move into the Covered California segment, I want to just briefly share about the older adult expansion. As Nancy mentioned before during her presentation, there's a new law here in California that allows individuals 50 years or older, regardless of their immigration status, to be enrolled in full scope Medi-Cal. They will still need to meet income requirements, and then if they're over 65 or they're disabled, they still need to go through the asset test. So they'll ask for any properties, monies, retirement money, all that. But just briefly, we do know that DHS automatically transition those that were already enrolled in restricted Medi-Cal, but there's still work to do. We still need to connect those individuals with the health plan. So here in Kern County, it can be Kern Family Healthcare or HealthNet. There's not that many individuals enrolled, so there is a big push to contact your clients if you're working with them or informing them to select the health plan. That would allow them to have a managed care plan and then kind of have additional benefits through either Kern Family Healthcare or HealthNet, and then have an entity that is kind of taking care of their health, and if they need additional support, they can also reach out to the health plans. And also kind of continuing with the same message for individuals that do not have Medi-Cal and they're eligible, to encourage them to apply. The older adult expansion is not going to affect their kind of like their immigration status as it relates to public charge, because this is a state funded, and we know that the only two items related to public charge that are being counted is any general assistance, so any money, or long-term care. So that reminder for individuals. The other thing I wanted to talk about, to please encourage your clients to have contact information updated with DHS, because this is really important, so that way they don't miss any important information from the DHS office. We don't know yet when the public health emergency is going to be lifted, but we do want individuals to follow their care and not get disenrolled from their health coverage because they missed a document from DHS. So that's all the reminder that I have. I know we do have our ORUC older adult expansion flyer. You can use that. If you need copies, feel free to reach out to me and I can send some physical copies to your address, or I can deliver them to you. And that's all I have in regards to the older adult expansion.
So, I always thought older adults was a good term until I realized I'm 50 plus as well. So I'm there in the older adult category. All right, now we're going to move on to, we have a training opportunity. All right, who's going to provide the update for this? Argelia.
Thank you, Rodrigo. This is Cecilia. We're getting you all confused today. Good morning, everyone. Again, like Nancy said, welcome everyone to our meeting. This is the flyer in regards to the information for the benefits call training. The benefits call is a new self-service website for all Californians, where they can apply for and manage benefits like Medi-Cal, CalFresh, CalWorks, and Cash Aid benefits program. This flyer will be forwarded to everyone, I guess, after the meeting. So if you are interested in participating in this training, it will be really awesome. once you get the flyer, go and look at the information. The registration may not be open yet, but it will be open by the beginning of June. So if you're interested in participating in this training, please start saving the date. And this is going to be an awesome training. It's really cool. For those of you who have already started using the benefits call, it's really cool. I really like it. And you can follow up on your applications and everything. But I'm not going to give you more information because we had to wait until we get the training. But thank you. So if you have any more questions in regards to this training, feel free to contact us or contact Argelia. Thank you.
Thank you, Cecilia. We also want to remind those that are not yet Benefits Cal approved or able to submit applications through Benefits Cal. They don't have a account set up yet to register early, and we can help you with guiding you through the process of getting approved through DHS for participating in the Benefits Cal portal. All right, so thank you very much. All right, I believe now we'll have Carlos Villalobos from Covered California. Thank you for joining us. He's going to give us an update on Covered California. What's happening with them? I know there's a live update coming up this week. Carlos.
Hey, good morning, everybody. Thank you for having me.
Thank you.
I know I gave a slideshow as well. If you guys want to go ahead and pull that up, and then I'll go ahead and go through that as well. Excellent. Again, so I'm filling in for Khaled today, and I'm going to give you guys some updates regarding the Navigator program. Next slide will show the agenda items that we're going to be going over. And we'll start off with the first slide of the immigration status and eligibility. So nothing's changed too much here. Obviously, under the Affordable Care Act, most immigrants qualify for health coverage, including the following groups that are listed here. Essentially, at Covered California, everyone can apply, no matter if you are lawfully present or not lawfully present, to see if you are eligible for Covered California or Medi-Cal benefits. I did reference our information for immigrants website as well, which has other resourceful information for immigration status. But I would note here that if you are not lawfully present, you can still apply, or you can apply for individuals that are lawfully present on their behalf. As an example, if there is a mother that's in the US that is not lawfully present, but their child is a US citizen, they can apply on their child's behalf as well. All we need is the provided information for the immigration status for the family member applying for coverage. And then note here as well, if an individual is signing up for Covered California, it will not affect their eligibility status, meaning this will not affect the chances of becoming a citizen for the US. Next slide. So just an update here in regards to the family glitch. The White House did release comments on the family glitch on April 5th of 2022. Currently, the family glitch has affordability of employer-based plans, which is based on just employee coverage. It ignores the family coverage or family member coverage cost. So effectively, it removes access to premium subsidies for the family. I provided an article here as well. It touches on a lot of great points on how the Biden and Harris administration plan on fixing the family glitch. And in that article, the Treasury and IRS have proposed a rule that would eliminate the family glitch, essentially lowering the healthcare cost overall. This is open for public comments through June 6th. And if it is finalized as is, it will be in effect for the 2023 coverage year. Next slide. So on this next slide, it's just a recap for, I believe Colette had shared this in the past, but policy updates on our end for a reasonable opportunity period, or ROP. It's a time during which an eligible consumer can submit verification documents to clear any inconsistencies in their application. Essentially, if they don't clear those inconsistencies, they can lose their APTC, as well as their cost sharing reductions and plan coverage in general. During COVID-19, we did offer an extension because we knew it could be difficult for those consumers to obtain those documentations. However, at this time, we don't have any further extensions planned, and enrollers will need to start providing those requested documentations to resolve any inconsistencies within that 95-day ROP. Failure to do so for their end may result in terminations of financial assistance or plan coverage. A portal alert for notice ID or NOD 03 will appear in your guys' secure mailboxes in CalHERS, and for all the affected users that need to be contacted or assisted. And then a note here, you guys will receive the portal alert the day after the notice has been generated for the consumer. Next slide. So this is just another recap as well. For SB 260, we have mentioned this before in the past, but this continues to be our most important project at Covered California for 2022. For consumers exiting Medi-Cal and becoming eligible for an exchange health plan that were previously assisted by you as an enroller will appear on the medical transitions report. So these consumers will, under SB 260's ruling, be auto-enrolled in a health plan, but you as the enroller will need to reach out and make sure they're aware and effectuating. For us, it's a great step to ensure for the consumers that there is no gap in coverage. But even the consumers who qualify for a zero-cost enrollment may need your guys' help in updating their cases, essentially their case details, or even just updating your guys' assistance in terms of the authorization. So for our end, the system will provide a pathway for these consumers, as well as provide enroller alerts to CECs or delegated consumers that are impacted. And on our end, there will be events, announcements, and resources, and even trainings that are available for CECs as we get closer to that launch date. Which leads me to my next slide, here updates. So for CalHER updates, everything here is very similar. The only new thing here is the auto enrollment toolkit has been published, I believe on May 18th of this year. It's an excellent resource tool that you guys can open up and utilize, and it also has flyers in various different languages to support consumers as well, and get them up to date on what the auto enrollment will do. Next slide. Also for CalHER updates, just another reminder here. For certified enrollers, you guys can check if a consumer has an active case by using the accelerated consumer delegation consent tool. Essentially, it's our detailed system that conducts a match-based consumer search based on the information provided for the consumer. And we have this so we can avoid duplicates and you guys are working on the correct case. And if it does find multiple CalHER cases, you guys can reach out and contact the service center to make sure you are working on the right case. And a note here as well, if a consumer has an existing Medi-Cal case and a new CalHER's case is created in Covered California's eligibility, the Medi-Cal case does take priority. So it could result in an enroller losing eligibility in that delegation. Next slide. And then finally here, we do encourage for our 2022 SCP Live event. We encourage everybody to register for this event. It will be happening on Thursday, May 26th of 2022. It's a great opportunity if you guys haven't already to hear from our new executive director, Jessica Altman. And we do have a great panel that is going to be hosting this live event. And they're going to be touching up on the legislative updates and also key enrollment opportunities happening through Covered California. So we do encourage everybody to attend. It is virtually streamed, and we did it that way so as many people as possible can have the opportunity to hear Jessica and also be the live event as well. And that's going to do it for me, guys. If you guys do have any questions or concerns, feel free to reach out to me, or if you have questions in the comments as well, I'd be happy to answer those as well. And I'll make sure to provide a PDF copy of the presentation so you guys can access those links as well.
Thank you. I saw Carlos on your account, and now I see Alfred over here.
Yeah, I apologize. Alfred's my first name. My middle name is Carlos, and I went by Carlos, but
all right.
Feel free to call me either name.
All right. Well, thank you. Thank you for that update. Any questions for Carlos? I don't see anybody raise their hands. All right. Well, thank you. Thank you for that update. And be sure to sign up for that live update on the 26th. That should be good information. Really glad that that's, they're looking at the family glitch. Hopefully that is something that we can get rid of so many families that don't meet the eligibility criteria because of that. So it's an unfortunate thing. It's it's something that's occurred since the beginning of Covered California, and very frustrating for families when they're not able to meet that eligibility and can't enroll with the subsidies. So thank you for that update, and hopefully we'll get some good news for the 2023 coverage year. We don't have that. So all right. Anybody else? Any questions, comments? All right. I think we're going to open it up for. Are we going to do evaluations now, Argelia, or should we do announcements? All right. So on your screen, there's an evaluation survey for this meeting. If you can fill that out for us, please. And then after that, we will have an opportunity for any announcements from your agency. Okay, let us know when we can start with announcements. I think we're going to go ahead and start with the announcements. If anybody has announcements, and then people can finish up their survey as we go along. Anybody have anything to share with us? Nobody? Maritza.
Hello, everyone. Good morning. I just wanted to let everyone know that, especially our CECs, if you need any information in regards to current family health care, please feel free to reach out to me. We are working on a marketing brochure, updating that, and I will soon get that out to you guys. And then if you're needing any provider directories or anything from current family health care, please reach out to me. I am your contact for CECs. So my phone number is 664-5536. And then I do have a question for the CECs, if somebody's able to answer. I'm just trying to find out, now that the 50 plus are being eligible to get on that, that full scope Medi-Cal, how are you guys doing on that? Is the enrollment picking up, or is it, slow? I was just kind of curious to know what our CECs are seeing in your areas. I don't know if we have any Omni Clinica or any other FRC CECs that can help us answer that.
Let's see.
I don't know if anybody can answer. Just kind of curious.
Well, I do see Luis on here. Luis, have you received an increase in questions regarding that specific issue?
Good morning. No, actually, we haven't. People have come in that are just regulars that have the Medi-Cal, the renewals and stuff, but they haven't really come in and ask me about that. I did some clients that we do come in here that are undocumented. I do give them the information, and I tell them that if they receive a letter saying that they are going to get full scope Medi-Cal, to if they have any questions, to please make an appointment, and then we can go over that. But other than that, we haven't got a lot per se.
Thank you, Luis.
No
And
problem.
We're kind of curious, trying to find out with other groups, what is RC, what are CEC seeing, when it comes to this type of enrollment. We were super excited to see the enrollment, being able to have access to full coverage now for those people, but we don't know, what's going on. But thank you for sharing, Luis. And I don't see anybody else from Clinica or Omni, so thanks, guys.
Yeah, go ahead, Nancy, because I know we have some
Sorry.
information.
Yeah, just real quickly, just to share here for CHI. Marita, we have seen, in the beginning, we did a push in regards to letting the clients know that this was coming, especially for those that were 50 and above that we had on our Salesforce database. We did some mailings, we sent them the healthcare option form, and then now we're kind of seeing them trickling in. I will inform you that based on your guys's media, information that you guys put, and Rodrigo being interviewed at the event that you guys had for 50 plus, CHI has been seeing higher call volume in regards to 50 plus. So we are tracking those as well. We're asking them exactly where did they see that information. So the community is responding. Honestly, I think not as quick, as fast as I would want it to, but they are. So I'm excited. I hope that, word of mouth, and that's what we're doing. We're encouraging everyone that calls. Please remind anybody that this is now available. Please feel free to give our number, follow us on Facebook, all that good stuff. So we're busy. Here at CHI, we're busy. Thank you.
That's awesome to hear, Nancy, because I know that we're tracking those as well. And Current Family Helper did see some come in, but the numbers were very low. So we don't know if they will increase as months move forward. And but yeah, I'm excited to keep on hearing what our CECs are doing. Thank you for the update.
Yeah, Maritza, and also I do want to share that we provided 3 phone numbers for media, and those were Clinica, Omni, and for CHI. And so we have had an increase in questions based from those people that saw us. Because Univision, I think, was a major media outlet that reached our population, our target population. We did get some calls from Fresno as well, so and Tulare County. So with those, we just provide information, and basically that's about it. And resources up there. I mean, Clinica is up there, and I believe Omni is in Tulare County. So we provided as much information as we could to get them enrolled. Any other announcements? All right. Well, thank you all very much for joining us this month. Our next CEC network meeting will occur in about approximately 3 months. We don't have a date yet for that, but be on the lookout for an announcement. So thank you all very much for joining us this morning. So have a great rest of the day.
Thank you all. Thank you, Rodrigo.
You're welcome.
Thank you, everyone. Have a good day.